Good morning, everybody. This is the Board of Health meeting for May 27th. We are here at the Norwood Senior Center. The meeting is recorded. First, approval of minutes.
Make a motion to accept the minutes?
And I second that.
All in favor?
Aye.
Aye. Okay. New business. Review and update the bodywork regulations. So do we have, Stacy sent us everything. Does anybody have any particular questions about the update?
And I love her highlighting, because
that was
that just
awesome.
brings my attention to what's important to us.
Yeah. What the change is.
Right.
Yes.
Yeah.
That was great. Has anybody ever seen skin braiding? I've never.
So it's not allowed, but I've seen
Yeah.
images of it.
What
It's
is it?
Skin braiding, which is when you basically make slices of the skin and you braid it.
Uh-huh.
And then you can't do it, it's not allowed.
Yeah,
So
I
that's
knew it
one of-
wasn't allowed.
There's a whole list of
Sound
things that's not
culty.
allowed.
Yeah.
It sounds culty.
But I don't know, but I can't imagine some of the things that they pierce.
God will do it.
I don't know, I remember doing them originally, but, bringing it back to look at it, and I said,
Stace, did you get these, are the surrounding towns similar?
Yes.
So these aren't just ours, they're Walpole's and Westwoods.
Well, Body Works, to be honest with you, there's not all communities have Body Works. Body Art is different, so Body Art, right now we're reviewing.
Body Works.
Body Works. Yeah.
So Body Art is, yes.
That's a whole
most
different
communities,
ballgame, right.
Probably all of them have that.
So these you worked off of this from the state regs?
Not Body Work, so
No.
we're talking about Body
Body
Work.
Work. Oh, okay.
So Body Work, no, not all communities have this. Some of
All
them
right.
do, so we did review communities that did have it
Yeah.
and kind of took pieces that we liked and pieces that we didn't like.
Yeah.
Try to come up with the most comprehensive regs that we could come up with.
Right.
And one of the things that it's not highlighted, but just the sections piece, we
Yeah.
added the sections to match the Body Art. So if
What
you're
is this?
looking, this is just a.
What is the significant difference between art and work, so that,
Two
in general?
completely different, they
Yeah.
just sound similar. but
One is
they're-
drawing pictures on your body, the other is carving pictures on your body.
No,
Well,
basically.
Body work is similar to, I don't want to say it's massage, because it's not massage. So, people that
Wellness.
don't,
It's for wellness. right?
it's things like Reiki, it's
Yeah.
reflexology. So basically, it's touching another person
Yeah.
that's not massage.
Right.
So if you don't meet a lot of times if you don't meet the requirements to become a massage therapist and be licensed as a massage therapist, you just do everything else and call it Body Works.
Yeah.
But you are still physically touching a person.
Well, we don't regulate massage parlors. to
Correct,
begin.
that is the state. So there's state regulations for massage. So
Right.
if the state came in and shut you down
Yeah.
for various violations,
Right.
You just call yourself Body
Body
Work.
work.
And
See, I wouldn't think
that's,
that would come under Body Works, Reiki and reflexology.
it all, so
and-
if you look in the
Yeah.
definitions,
Wow.
it tells you, the best section of any code is the definitions.
Yeah.
So when you look in the definitions, it will tell you every single thing, body work. If you read the body work on page 2,
Yeah.
you go down, it tells you exactly what body work is.
Right.
And what we added here is the certification underneath. So anyone, like if you open up a shop and say you're doing reflexology,
Mhm.
well, what is your certification? So
Yeah.
you have to
Right.
show that you had some type of training.
Right.
Because if not,
That's-
anyone
that's
could
a
just,
biggie, yeah.
and again, you're touching someone, you're touching another person.
The one thing I didn't see in here was, how many hours are required? Does it say?
It
Well-
does on the national certification,
Yes, so
Oh,
we,
because I looked it up.
Okay,
Yeah.
so that's where it is, it's on the national certification.
Right.
yeah, so each
Okay.
one of these certifications, they will tell you what is
Specific
required to
hours.
get that,
Specifically. Right.
that certificate.
Okay,
Right.
And this is always going to be changing, because they're gonna
Oh,
come
yeah.
up with some.
So they're gonna
other-
find a new word for it, and they're gonna
Exactly.
try and get away with it with a new word,
do
right?
we have anybody that is licensed currently as a Body Works?
So we have two establishments that are licensed.
Okay,
There were others that, let's say, did not meet the requirements that we found.
okay.
So we have 2 right now.
And they can bill for their services.
No, this is you go in and you want your feet rubbed, it's called reflexology. You go
Wait a
in and
minute,
have-
you can go into somebody that is certified and say, I need you to perform Reiki on me, and they won't charge you?
Oh, no,
Oh,
of
no,
course
no,
No, they charge
Oh.
you, it's like getting your hair done.
Oh,
Yeah.
that's what I
Like getting
thought.
your nails done.
Yes, yes,
Yeah,
yes.
this is not metal, we do not put regulations on anything that is
It's-
licensed by a doctor or
Right.
No.
nurse practitioner. Those are medical practices.
Okay.
Those, they do billing. This is
I get you.
another way, like I said, to get around massage therapy. It's very high
And-
risk for human trafficking. It's,
Yeah.
that's why we have strict regulations, and we work very closely with the police department.
But I do understand that Reiki, if I'm saying it right, is very helpful to people that are sick, is what I found out, like,
But that's
Yes.
all included in this, but
Yes.
it's,
yeah.
yeah.
But you can't just offer it and not have any kind of training. So this is telling, to get a permit from us, you have to be trained.
And what's
Because
the,
what would stop any of us from saying, we do that and
Yeah.
just open up a storefront and
Right.
hang a shingle?
Yeah, say they can do Reiki and, you know, they watched it on YouTube and said, okay, now I'm gonna go open a shop and,
yeah,
you know, do Reiki, but this is now requiring them to have the proper certification.
so what do we charge for a permit?
So, for this, we charge, so it's not, that was one of the things we removed from these regulations, the fees were in
Fees.
here, and you don't put fees in
Fees in.
regulations,
Okay.
fees go in a fee list.
Okay.
So, the body art individual is $200.
Okay,
I mean, I'm sorry, I'm
Body-
wrong, Body Works.
Is what?
Is, where is Body Work on here? Body art. Oh, I think it's not on, I didn't,
Hold on.
What does Body Work?
I believe it is 200
I think it's
per
200.
practitioner and 500 for the establishment.
yes.
so each practitioner needs.
Oh, here it is.
Each
Yes, Jen is
practitioner
correct, 200.
Requires, each practitioner requires,
200.
Yep. So there's the
And 500
establishment
for
fee,
the-
and then each practitioner.
Practitioner
So for
requires.
4 practitioners, they each have to do their own, and then the establishment has to.
has to do it on top, okay. And we do have, so we do have the right to go in and inspect?
Correct.
Okay, and there are fines
Correct.
associated with that. Do we have like an initial fine and then incrementally goes up? Or you're fined
No,
once?
it's not like tobacco.
It's not,
No.
okay, that's
But
what,
we can do the, fines can be daily until it's corrected. And
okay,
then if you don't pay them, you can shut down the establishment.
okay.
But I wanted to point out some of the yellow highlighted
Yep,
sections, a
yep.
couple of things I just wanted to point out to you that, one of the things we don't, that I'm suggesting that you.
What page, Stace?
Oh, page 4
Page
is the
4.
use of aliases.
Yeah.
So what happens is a lot of times, people have a legal name, their certifications are under the legal name, but you go in and they say, I'm Susie. So you have a treatment done by Susie. So if you want to do a complaint and you call us and you
Ooh.
say Susie, you go in, we have there's no Susie, and you
Okay.
deny the name of a Susie. So you can't use aliases
Okay.
unless it is on the license and it's posted. So you could have we make you put a picture and then your aliases, because.
Yeah.
So we're covering all the bases
We're-
here. I
we're
mean, you
trying.
know,
Yeah.
it's,
We're trying.
Well, that's a good idea.
no,
And
very
it-
good.
And it comes from experience. It comes from licensing them, working with the police department, finding out the ways to get around things.
Okay.
Right.
Because it's very difficult. You go in and
Wow.
you ask for a person and you can't, you look up the list of who has a permit or a license and the training, and there's no such person because they go by an alias.
Well, it's like a plumbing license. You need any advertising or anything like on your truck, you need to put your master plumber's license or your journeyman plumber's license on any advertising or any truck or anything like that. This is basically what they're saying, is that you need to put the name,
The correct
the correct,
business name
Right.
on there.
so the correct business name could be John Jones, but they calling themselves Paul, you know. so
Yep.
that- anyway.
Oh,
And-
Stacy, that was a lot of work.
Just one more thing I want to point out.
Yeah.
Yeah.
If you'd like to. You're already required to have CPR, but we added AED. So
Oh,
each facility would need an AED.
Oh, that was
So
good.
just things where, we're looking at safety, we're looking at safety of the
Yeah.
the customers.
Yeah.
And that's it, really. Those are the biggies.
They're gonna have to have the, on the wall itself, the
Machine.
The
Machine.
AED, correct,
Yeah, okay.
yeah. So I think that's a good safety
I
measure.
think that's not a bad, I think most places now require things like that. Gyms have to have them, schools have to have them, any health facilities, doctor's offices, town hall.
Yep.
Athletic department,
Yeah,
fields,
right,
everything.
Yep.
Too many kids dying.
So, do we have them do a log for the AED?
Like
That they check it?
So that would be part of having an AED, is doing what you're supposed to do with an AED. So they would be responsible, if they have one,
Okay.
to check it, make sure it doesn't expire,
Charge,
okay.
that, you know, the pads don't expire. And the people are also gonna have to be trained, so you'll have to be trained in CPR and AED,
Yeah.
first aid.
Right.
Okay. Is this something that we check on every once in a while? or
Kathy, I
don't
have to
check
do that
on
in
them?
my office. over
Yeah, so it would be
30 years. I have
inspected just
initials
like,
in the
just
time,
like
every
we do
day.
other
Every morning.
tanning and other.
It's too important not to.
Right.
Okay,
Other things that we permit.
okay.
And it says, it actually even says in there that you have to allow for inspections.
Okay, that's good. I mean, right now, what are we gonna do, yearly maybe?
Yearly, then at least a couple of others, and then on complaints, like if we get a call from the police or
Okay.
get a call from someone, we'll go in.
Okay. That's good to know.
Okay.
Would most of our complaints come from the customer or the police doing a sting?
A lot of times, well, I shouldn't say a lot of times, in the past, there has been a customer that calls the police. If it's a police investigation, and they let us know.
Good.
Great.
So if you would like to make a motion to,
To approve these,
Right.
Oh, I would, yeah.
I'd like to
Right.
make a motion that we approve the changes
I would.
for the practice of body work.
I would second that.
all in favor?
Aye,
Aye.
Okay.
great job.
and then the next step would be to, when would you like to make this effective?
ASAP.
Immediately?
Yeah,
So you could make an
Well, we did-
effective tomorrow.
Yep.
The only thing I ask is there's two that are already licensed and up and going, maybe that you give them, if you already have a license and already have a permit, you give them time, which would be
30 days.
November.
can we say July 1 or September 1?
I was thinking, again, it's up to you.
To be
with the
certified.
With the new licensing, which is November 30th, they have to submit their application by
By the
November 30th to
Okay.
be licensed for the new year. So,
Okay.
With their certifications all in place, with CPR
Yes.
and,
yes, because
Okay.
we have to give them some, I mean, they have to.
Time to take the-
Oh, I see what you're
machine.
saying, yeah.
They have to, if, you
They have to
know.
take courses
Wow.
and
Yes.
so on. Okay.
you're generous, Stacy,
All right,
November
so-
30th.
It's up to you, it's not.
No, no,
it's-
I'm,
Because we have to notify them, because if they don't meet this, they would be immediately shut down.
If there's anything that they can do immediately, is there any way to say that we would like to have these things done immediately, but everything else we'll let go until November 30th? In other words, if you have to take courses or things like that, like the AED, you know, we give them 30 days to,
well, how much does that cost, the AEDs?
I don't, they have different prices, the prices have come down quite a
Like-
bit.
like
from what they
500?
used to. We're not asking them, yeah, I don't think it's a lot, probably not a lot of money. But it's just hard if you make different dates.
oh, I see what you're
for-
saying, all right, so
I
make
have a
it,
feeling some of these things they'll get on right away.
Yeah.
Um,
My question is the only thing is if we get somebody new between now and that
That's
hasn't,
effective immediately, so they wouldn't be able to.
Right.
They would have to meet everything in this reg. So
Okay.
if someone applies next week,
Yes.
they have to meet everything. This would
Okay.
only be for.
The two
the
grandfathers.
two that are already.
The two that already have a
Okay.
license, just to,
okay, all right.
it's up to you. I mean,
No, it's
No,
fine,
I-
I said, but the new ones are what we're concerned about, so,
Correct.
Yeah.
All right.
fine.
So we want to make it November 30th, or do we want to make it November 1st to give you guys time? Or do you want to do it all the same date?
Well, if you wanted to make, you know, an effective date for new businesses as of whenever, we can do that and then allow the two that are here to have until November 30th. which is their renewal.
Okay.
It technically would be January 1st, to be honest with you, because November 30th is when they have to have their application in.
Okay.
Because it takes us a couple of months to
Get
process
everything together.
So same with
Okay.
restaurants, they all have
Right.
to be in by November 30th.
Okay.
And after November 30th, it's late fees.
Yeah.
So with this, I would, you know, you can keep it easy and say January 1 for establishments that are already permitted.
Already permitted,
And
okay.
then,
So January 1
Effective
for
tomorrow.
already,
Well, yeah, and,
already permitted.
January
and-
1 for grandfathered in.
yeah.
well, we don't grandfather
Right.
things in public health, but you can just say for
Already
already
permitted.
permitted.
Yeah.
And what do you want to say for new businesses would
And
be?
for new business, you
I
can
would
do
say immediate with new
Immediate?
business.
Okay.
Immediate
So that
new
would be
business.
tomorrow,
I don't
you
know
know, pick
if
tomorrow
that's
as a
what
day
it
or-
is. Yeah,
New
Well-
business, no.
They should have it before,
Okay.
along with their application. They
Right.
should have all.
They don't get approved
Right.
unless
Correct,
it's
so
done.
they would have to meet all the requirements of the
Right.
regulations that you just approved, the
Right.
amendment to the regulations,
Right.
to be able to get a new permit, to open up a new
Yeah, I think
establishment.
that's,
yeah, because I mean, if you did it as of January 1st, that's going to give them 6 to 7 months to
Mhm.
operate without going through the new
Correct.
regs. So
Right, we don't wanna do
No,
that.
we don't want to do that. We just as soon get it done. And, you know, if you're going to do it,
So
then, we
you-
don't have anybody
Pending?
Pending?
No.
Okay,
No.
all right.
so why don't we say June 1 for new businesses, because that's next week,
Yeah.
June 1, so. June 1 for new businesses, and January 1 for those already permitted.
Not that I'm expecting a rush of people to.
You never know, we
You
might
never
get
know.
back to the,
Yeah.
So we need to vote on that, so.
Make a motion?
Second it.
All in favor? So
Aye.
January 1 for already permitted, and
Yeah.
June 1 for new business.
Yep.
Okay, great. All right, moving along to review and update body art regulations. This ought to be interesting.
So same thing with body art, we haven't looked at these in quite some time, and we haven't had much people looking to ask for a body art establishment, so we thought since we were reviewing Body Works, why not review body art? So any questions on some of the recommended amendments?
No, I like the idea that they have to be, you know, they have to be under somebody that has already done
Oh, the
everything.
apprenticeship.
Or the apprenticeship. I think that's a really good addition.
So do you anticipate that a lot of the businesses that now offer things like eyelashes and eyebrow, that they will be applying for this, or do you know?
What we will probably see is permanent makeup. So there has been some interest in permanent makeup. The only thing, what we're changing in here, as you can see on page,
19?
is page, 19 and 21.
Yeah.
Well, 21 is about the apprentice. So what happens now is to receive your permit, most places required an apprenticeship. So you don't just get out of school and then just start right off. These we didn't have any regulations really on apprenticeship. So how do people get their apprenticeship? And then if you're in the shop and you're doing work on someone, I think the customer needs to know that that
You're
is
an
someone
apprentice.
You're an
that's
apprentice versus, yeah.
So we will require an application for the apprentice and also ask for application fee. So there'll be an application fee with that, obviously much less than,
Okay.
so that's a suggestion I'm asking if you would like to do that. But you have to, also, another thing that we're requiring, that this regulation, the previous regulation had, it was very clear that you needed anatomy and physiology to do tattooing,
Yeah.
piercing.
Yep.
But you didn't for the permanent
Microblading.
makeup, for the microblading, it didn't make
That doesn't
sense.
make sense.
It might have been implied, but the way the regulation was written, it sounded like you didn't need it. So
Right.
this spells it out that you need anatomy and physiology. If you're tattooing around or microblading around someone's eye
Eyes.
or on their face,
Right.
you should really know anatomy and physiology. So
Okay.
a lot of other communities also have that.
Okay. Now, it doesn't say how long the apprenticeship program is supposed to be for.
Yeah, it does.
Have
2
we-
Yeah, a
years.
couple of years, yeah.
Okay.
Yep.
Do we need to put that in?
It's in here.
Here, it says.
Yeah,
The
apprenticeship.
apprenticeship shall last no longer than 2 years.
Where did I miss
It's
that?
on
19 or 20?
21.
Okay.
See,
It's not highlighted, but it's.
Yeah, it's here.
It's number F. The apprenticeship shall last no longer than
Within 2 years,
Certainly.
okay, I got it.
Stacy, can I ask a question, Board? And I just forgot it. Does any of this piercing apply to girls getting their ears pierced?
No, that's
No.
exempt.
That's,
That's exempt.
That's a different, because you can just get the little guns, a single,
Okay,
single
okay,
use. You
okay.
can get that done. This is
Belly
not for that.
piercing, nothing?
No, that's only
Yeah,
ears,
yeah,
ear
just
piercing.
ears.
Ear
Belly
piercing.
piercing falls under this
Okay.
regulation. Another thing that with the apprentice too, we pulled out, so to be a practitioner, you have to have hepatitis B, immunization. We put those same requirements on the apprenticeship.
Oh, good.
Because if you're working
down.
with
Yep.
fluid, you're doing the same exact,
Right.
basically the same procedures. You should have the same requirements
Right.
that someone that's a practitioner has.
Yeah. Yeah.
That's a good change.
And I'm glad we made it laboratory, confirmation of immunity and stuff like
Yes.
that.
Yep.
And again, how do we receive complaints on this? From the customer?
Yes, this would
Usually-
most likely be a customer, someone saying, I received a piercing, it became infected, or I went in the shop and it
Okay.
it wasn't
Unclean.
clean, the person didn't wear gloves, whatever the complaint could be, just like we would with any other establishment that we.
Is anything posted, is anything required of them to post anything like certification or?
I
They have
I
to
didn't make
post
any
their,
changes to it, so I
Okay.
think,
they have to post their permits.
yeah, the permit, but I
And
don't
that
think the
they're
individual.
licensed as well,
Okay.
huh?
Yeah,
Yes, because they would have an establishment license
Yeah.
and an individual license.
License.
Usually we
Right.
require that, we didn't make any changes.
No,
Okay. So
but-
anything that was already there,
Yeah.
the
Right.
highlighted were just the sections that way, I can't recall.
And I was
Yeah.
glad to see that there's no more than one apprentice per shop
Yes,
versus
Five.
one is, one person in charge of 5 to 6 apprentices or something. I think that's, I was glad to see that.
Now, these are on the website, so if somebody wanted to look.
yes, the old ones are, and then once you approve it.
The new ones will be on there?
Yes.
Okay, good. Just in case people want to look and see. If they wanted to find out if an establishment was licensed, can they find it from us?
Yes, they could just give a call.
We don't currently have
We
it.
don't have any, so.
Right.
Jim, like, we don't have
Jim's gonna get 25 calls.
We don't have any.
Yeah,
Yeah,
no, that's
well,
one thing.
you
But
never
in
know.
general, yes, if anyone has a question about
With-
anything being
Yeah,
licensed, they
with
can call
anything.
Yeah.
Tanning, camps, anything, you can always call.
Okay.
Thank
And I'm
you,
glad to see
Stacy.
we put an age limit on this thing so that, yeah, okay. That's good.
Okay, so someone wanna make a motion?
I make a motion, we accept those,
Yep.
the body art regulations.
All in favor?
Aye, thank you.
Effective date.
Effective date.
Yeah,
Do we wanna make that effective immediately, because we don't have any?
Yes.
June 1st again?
They don't need any
Yeah.
equipment.
Or you could do it June 1st or do it immediately, it's up to you.
Might as well keep it all the same, do it June 1st. I mean, that's right around the corner, it's not like it's
Okay?
it's a couple of days from now.
yeah.
Yeah, so that will, I mean, they follow all the other regulations, we might as well make it June 1st and not
Okay.
make it not.
And then one last thing, if you could come up with, it's on the fee schedule, so
Oh,
the
yeah,
apprenticeship,
looking at
so the
that.
apprenticeship for body art they have to complete an application.
Mm-hmm.
So I looked up fees in other communities, they're usually half of what the practitioner fee is.
Okay.
And so, which comes to mostly, I would say, so but since ours is 200, 100,
It would
it's up
be
it's up to you.
$100.
If you want to do 100, you want to do 50, you can do whatever you.
No, I
Yeah.
think 100, 200 in revocation of permit is reasonable.
Right.
Great.
You wanna make a motion?
I'll make a motion to accept the fee schedule or.
For 100?
We already
For
For
did.
100 for
Yeah,
the
yeah.
apprenticeship and it's 200 for the
Yep.
main person. All in favor?
Aye.
Aye.
Passed.
Thank you.
You're welcome.
Stacy, thank
That's-
you.
Thank you, that's a
Okay,
ton of
yeah,
work.
that's a lot of work.
Okay.
Okay.
And we have-
They'll either be running to other towns or staying.
Okay, moving right
Public
along.
health.
Diane,
Public
you're
health
up.
nurse, Diane.
Good morning, everyone.
Morning.
Morning.
Any questions about the report?
No, TB, that's my big thing. Any, no
None.
new cases or anything? Good.
None.
Okay.
Yep.
I have a question.
Yeah, sure.
Go ahead.
I got somebody asked me on what, over 65, obviously my category, what they should do for the new COVID vaccine.
Okay.
Now, on television, it said that the FDA said to take it, but they suggested you wait for the CDC to come out with their recommendation for the COVID shot over 65.
Yeah.
Have you heard anything on that, or where we should go with that?
So,
Have
they're
anybody?
gonna be, there's gonna be probably a new one out in the fall,
Yes.
just like the flu.
That's what they're saying.
So,
But they're recommending certain people under 65 don't need it.
okay, well,
I thought it said, recommends that everyone aged 5 years and older get 1 dose of updated COVID vaccine
so
yearly.
we would have to wait for the recommendations of the CDC.
Okay,
If they
that's-
change their recommendations anytime soon, we'll definitely update it on the next report.
Is that the FDA or the
This is the CDC.
CDC.
CDC? Okay.
So depending on if
FDA.
they're going back and forth between recommendations on who's gonna get it and who shouldn't get it.
Yeah.
I did see a little blurb recently this morning about it,
Oh, Ian?
but they didn't give me a whole lot of information.
Okay,
So
okay.
I don't wanna give anybody misinformation.
No, and they said they were referring back until they hear from the CDC.
Yeah, so
It
I
might
would
take a
prob-
while.
Yeah, I
but-
would, for right now, I would just follow the CDC's recommendation for this past
Right.
fall's dosage
Yes.
and vaccine, so that I would wait. But if anybody wants to give me a call, feel free, 713-884-9195.
Oh, thank you.
We can discuss.
Because of health
further.
reasons, because their health reasons
Yeah.
with the new vaccine.
So for for this past fall, you could, if you were immunocompromised, you could get at least 2 doses, 6 months apart, right, halfway through. Because just to keep your immunity up,
Yep.
so.
That's
With this-
interesting. I didn't know that
Yeah.
you could get 2 doses a year. I thought it was just the one.
One, me too.
If
You're immunocompromised.
Yeah.
Yeah.
So that would be something that your doctor would recommend?
Yes.
Yeah.
Okay.
So I did have some individual who came in recently and who is immunocompromised and asked me about it. And I said, you can get another dose now, but then,
6 months.
6 months from now, you're gonna wanna get the one in the fall. So, to just keep your immunity up.
Which is usually in October, correct?
Yeah, September, October.
Yeah.
Any difference in the vaccines, as you know, containing what it contains? I don't know how to say that.
That I'm not sure
Ingredients.
yet.
Yeah, ingredients.
I mean, it changes all the time, so.
Yeah. I think they'll probably be looking a lot closer at flu A this year.
Yes,
Because last year, we had record numbers.
a ton, yes.
Of people that tested positive for
Yeah,
flu A.
even in the
So,
town, yeah,
Yeah.
our numbers
Yeah,
just jumped
I think
up.
nationwide, they
Skyrocketed.
were just
Yeah.
all over the board, so.
Yep.
I anticipate that they're gonna look
gonna
at
go.
flu A and find,
Isn't the way that they do that, Diana, they take what's happening in, say, Japan or China or what, someplace like that, that is so far ahead of us?
So, yeah, it kind of goes across the country, so it starts in the west and then it wraps back
And then
around.
wraps
So
back
when we
around.
get back to that season where we're kind of all indoors and
Mhm.
sharing our germs and
Right.
so if that's what their season is like now.
Then they
take a look
anticipate
to
that's what
see.
it's going to
Yeah.
be in the future?
Yeah.
Okay, got it.
So, and then with travelers, and it just spreads everywhere. But what's nice is that our numbers for COVID and flu have definitely decreased since this fall.
That's great, Diane.
So,
Yeah.
which is nice.
Thank you.
A lot less people got their flu shots than before, is that what you're saying?
Well, they have, but I'm just
Okay.
saying that a lot of people are now less sick because everybody's moving outdoors, so,
Right.
which is nice.
At one point, new college students needed, oh no, that's when the virus went around, right?
Yeah.
Needed an inoculation or an update on their vaccine. Was it a couple of years ago?
You talking about COVID?
No,
What, flu?
no.
all vaccinations.
Meningitis?
all-
Meningococcal?
Meningococcal.
No, it
too.
was something that was that was highly contagious, and it was starts when the kids go back to school.
Pertussis? Whooping cough? Tdap?
Maybe. But there's no vaccine. They called for immunization, update on them, or proof of it, or
Well, I
something.
think
Yeah,
every.
colleges, you
Yeah.
have to have
Seminar and things
Yeah,
like
you
that.
gotta have
Yeah, that's what I'm looking-
required vaccines that you need
Right.
for high school and, all school.
But that's been for years.
For
Cal.
years.
Yeah, that's not something that's new.
Good job, Diane.
Diana, thank you, and thank you so much for offering yourself to the town with all you're saying, just call me, and
Yes.
taking the time to answer these questions.
Give me a call.
It's very, very helpful to the townspeople.
And if I don't know, I'll get back to you with.
And we appreciate that so much.
Absolutely.
Thank you.
Environmental Health Inspectors Report.
Angela DeLuke.
Good morning, everyone.
Morning, Angela.
Okay. Update list, there were no updates for this meeting.
Okay.
The
In
new-
the, in the future, I'm sorry,
Oh.
Angela, I didn't mean to
No, no.
interrupt. Do you want, instead of just having this page that says no update,
No,
do you want to just, if there's no update,
there's no update,
provide that
just- yeah.
form? I just
Oh,
try to
I
save
don't
the
know
trees.
about that,
Yeah.
Jenkins.
Or,
Save a
or
tree.
even add at the bottom of the next.
that's a good idea. Why don't we
Just
add
add
to the bottom
nothing
of the
new,
new food?
you know, no,
Yeah.
no new
One new
Yeah.
updates.
Just save
What do you
piece of
think?
paper.
And the new establishments, a few have opened.
Yes, Billy Mulligan's is open, Deli Delights is also open.
Deli Delights?
Yeah, the former Cafe
Paprika.
Paprika. Yeah.
What is that kind of food? Indian?
Yes,
Uh-huh.
and the other three are still waiting to be open, they're still pending. However, Crave should be open by the time the next board meeting rolls around.
And what's
Okay.
Crave gonna be?
That is Mediterranean. Shawarma sandwiches and all that.
Oh,
Ah.
What kind of sandwiches?
Mediterranean.
Yes.
Yeah.
Is it just, no, any groceries or just
Spicy.
food?
Just food, I believe. There's no groceries, there's no retail
Yeah, yeah, it's pretty good.
food to be offered.
How's, yeah, it's just no parking up there, you know? It's so hard to park,
Yeah.
even when Little Tony's was open.
All right.
Before we go into the new food establishment, the inspection, re-inspection report there, what's our policy on windows open without screens?
That's a no-no.
Windows and doors cannot be open without screens.
Okay.
Yep.
So-
Remember years ago, we did that down in South Norwood.
Yeah.
Oh, Joni was next door to the bakery every day.
I know.
I just wanted to do it on air because there's been, I don't want to name the facilities
No.
because they may just not know the rules. But there have been a couple that I've noticed that had windows open and no
No
screens.
screens, okay.
So,
So screens have to be provided to windows and doors
okay.
if you're gonna keep the windows and doors open.
Okay.
Is that something that we check to make sure that they have screens?
Well, I
On
mean,
the
if they went
windows,
in
but-
for an inspection, if the windows were open with no screens, that's a,
That-
And if
that's,
somebody
Yeah,
calls,
right,
I mean, there are
right.
people
Well, the
that
front door's
are.
open with no screen and there's
Right.
flies in the establishment, that's obviously the cause of the flies. is
Okay.
your Doors open.
More than flies.
Yeah. so-
Can we require screens even though we go in and the window's closed? And you've heard that they open the windows?
We would have to see it.
Oh, you'd have
for
to
it
see
cite
it.
Yeah, we make notes on our reports, recommendations, reminders. We do that
Oh,
on our
next.
reports, so
busy
some,
day.
some of it's a violation of the environmental reports, we also make notes and some recommendations as well.
Okay.
And reminders. So
Okay.
These are discussions we have with the operators at all times.
Yeah.
Okay.
I mean, I think they just don't know the regulations. They didn't know
It's
the
possible, sure.
regulations, so
Yeah.
I'm not gonna spoil it for them, but I think
It's that
we
time
need
of
to-
year, so we'll be on the lookout for that as we
Okay.
do our inspection.
I can give you who they are, but
Sure.
I'm not gonna put it on
Okay.
television, so.
You're not
Sure.
gonna turn them in now?
No, I'm sure,
No,
I'm
not-
sure it's just
Yeah.
that they don't know.
Yeah.
So now they'll know.
Yeah.
Okay.
Yep. Yep.
Okay.
Any questions on the inspection reports?
No, I didn't have any. It was nice to see that we didn't have any critical violations.
What was the problem with the sewer backup at Chipotle?
Their,
Oh, Kyle.
their grease trap, I think, was full, so they had somebody come out, pump out the inside one, and they had another company coming out the day that I went there to pump out the outside one.
Did somebody call you, or was it just found on a routine inspection?
We got a phone call, I believe.
Ah.
Yeah.
Biddy Fish and Chips, did we see that the leak has been repaired?
Yes, that was confirmed by me, yes.
Okay.
So they do have their food permit and they're obviously operating.
Okay. And Cafe Fresh, it says a re-inspection scheduled. Have we been back there?
Food where, I'm sorry?
Cafe Fresh?
I'm going back there tomorrow.
Okay.
Same with the crushed peppers, their
Yes, that was
reinspection
my next,
is
yeah.
due tomorrow morning. They'll be doing the reinspection. So there'll be an update for them
Next month.
next month.
Okay.
Okay.
And, yeah, I was real happy with everybody paying attention to the regulations and
Yeah.
everything else. We have no majors at all.
No majors, which is nice to hear.
Yeah, it is. So I think that was the only ones I had, Kathy.
Yeah, I didn't have anybody. I was very happy with it. Do you have anybody, Carol?
No, I just wanted to know if Chipotle was, Kyle found it, or
Okay.
if somebody called. How would somebody know that the grease, you know, how would they know that, Kyle?
I think the floor drains were backing up.
Yeah, that'd be a hint.
That's indicative
They
that,
closed when it happened and, like disinfected everything.
yeah,
So, on top of that.
thank you.
Now, when they say that there's 6 lifeguards, do we actually see the names and the certifications of the 6 that are on?
Yes, they upload the certificates online in
Okay,
their database in a portal.
okay.
So that's part of the pre-inspection process. We
Right.
look at those certificates, make sure they're valid and current
Okay.
before we even schedule an inspection.
Okay.
That's part of the process.
So is there any way that we can check to make sure they're valid and not just picking a name out of a hat and saying?
No, they're actual certificates.
They're certificates.
Actual, from either the American Red Cross or other representatives.
They have the date that it was taken, the date that they expired.
Okay,
And they do have contact information if you want to verify.
Okay.
the class, but
do we ever verify any at all?
Not
I mean,
really,
just for-
no. Those are
Dates.
legitimate companies that offer.
Yeah.
The American Red Cross is the
Okay.
biggest one they use.
Okay.
Um,
No, just to see that they're working there, not to see that they're certified.
Yeah, so when we do our pool inspections, whichever lifeguard is on duty, say at one of the smaller pools,
Right.
we ask for the certificate and we match it with the one on file, make sure the names match.
Okay.
The expiration dates match.
Good, good.
So,
All right.
Have you been told at all when the Haas Pool is gonna open?
I have not.
Okay.
That is-
I
Slow,
just-
slow.
Well, I just see that, I've seen all over Facebook, people asking, are we gonna have enough lifeguards for the new pool?
The town pools usually, the lifeguard availability has never been an issue.
No.
The Civic has been advertising desperately to certify students, give them a little extra money
Yeah.
to be
We
the
always had
lifeguard.
enough in
Huh?
years past.
Yeah, we've always had,
So-
yeah. I just happened to see it, I'm like, oh boy, here we go.
Between 15 and 25 lifeguards per season, I remember from years past that they have available
Oh, good,
for both Father Max and
good.
Max.
And the summer camps are coming along good? They're all set up
Camps,
for the
Yeah, to
town?
Diana.
Diane, yeah, she
Oh.
said most of them are,
All
I
set,
think she
yeah.
said them on her report.
On the report, yeah.
Yeah, she said, we are ready for summer 20 inspection season and have received many applications. The deadline for new camps to apply has closed. If you're a seasonally established camp, you have a few more weeks left, please apply, renew online, and then she'll do the inspections. All camps must be inspected and permitted before they can open.
Yeah,
Yes.
and CM White down at the Civic is right on things.
Yeah.
Yeah, so they'll start, the week of the 23rd is when some of our full-length summer camps
Right.
start. So
Start.
that's a very busy week for Diana.
Yeah.
Okay.
Do you know how many camps we have in the town?
I
approximately?
believe as of right now, it's about 7.
Oh, okay.
We have a few that run throughout the entire summer, and then we have a few that are for a week or 2 weeks, depending.
Okay. Good. Anything else?
No, that was great.
Thank you, Angela.
Great.
Thank you, Angelo, thank you, Kyle.
Thanks.
All right. Stacy, director's update.
Okay, just a few things. First, I would like to just let you know I received notification from the superintendent of schools, just with a letter of intent to inform us about the summer meals program that's going to start up again this summer. It will start July 7th and go through August 7th, Monday through Thursday, serving food, breakfast and lunch at the Norwood High School and the Willett Early Childhood Center.
July
Two
7th
centers.
July 7th.
July 7th to August 7th.
Fee, no fee.
Nope, this is any of the children up through age 18 can go and get their
Lunch and dinner?
lunch and breakfast and lunch.
Breakfast and
Did I say
lunch.
dinner? I'm sorry, I meant
That's
breakfast and
okay.
lunch.
No, I just wanted to clarify. Okay.
And if you want to know the hours, breakfast is 8 to 9 a.m. and lunch is 11 to 12:30, and they expect around 400 a day of meals served.
Wow. Okay.
So it's just an update from
And
them.
that's from the schools.
And that's from the Willett and the high school?
Willett and the high school will be where you can get the food.
Wow.
Well, that's good that we can keep that.
Program running,
Yeah.
yeah.
Is that through us or the
No, the schools, the
committee.
schools they were just letting us know because it's a food service.
Yeah. That's nice to know. Okay.
And then next, I just want to let you know about the communication from Norfolk County Mosquito Control. And again, I'd like to push that website, norfolkcountymosquito.org, where you can find out when they're putting out the larvicide or when they're doing the spraying.
Yeah.
So the aerial larvicide, which we talked about last time, again, they sent another notice about them putting the larvicide on the wetlands. It's not a spray, it's the larvicide that's usually applied through with a helicopter. So that came out on May 21st. They let us know, again, reminding us of that. And then second is the spray. So that's when you could go on, and that's when they go up and down the streets and they spray. They let us know that normally it starts May 27th, it's usually around that time, but due to weather concerns, they pushed it back to June, so June 7th that week. So sometimes people can go on and you can request a spraying for your property. So if you requested it like that last week in May, they're gonna be pushing it back. They really are dependent on the weather. It can't be raining and it can't get too cold because you need the mosquitoes flying.
Should you keep your windows closed or it's not?
Yeah, you should, I would keep my windows closed if you can. So it's good to know when Norwood is done on Wednesdays. So
Oh.
just to know, and if you can go on to, the reason I mentioned that website is that you can go on and take a look and see what streets they're doing, so then you'll know.
And you can request them to come into your yard?
You can request them to do your, so you
Fly
can,
over.
yeah, no, they'll go down your street. So you can request, they
Instead
don't
of-
go in your yard, they drive by. You've probably seen the trucks, I don't know if you've ever seen them. I was out one time walking my dog and I saw the trucks, and they're very nice. They'll stop and say, I'm not gonna let you finish your walk with your dog and then I'm gonna spray.
Yeah.
But, yeah, and that goes through September, to Memorial Day to September usually. And it's, spraying begins at sunset and ends around midnight. So again, norfolkcountymosquito.org is the site you wanna go on. And I'll also post it to the website too,
Okay.
this information.
Good.
So the www.norfolkcountymosquito.org, there's no county, just Norfolk Mosquito?
norfolkcountymosquito.org.
County
Forget the www, you don't have to use
Okay.
that anymore because
Okay.
I think that,
That's
it's just.
old fashioned?
Yeah, you don't use
Okay.
that anymore.
All right.
But just norfolkcountymosquito.org.
Okay,
And again, we can link it to the town website too, so.
okay.
Anything you want to know on that. I think people just want to know when their area is being sprayed, and they can visit that site.
It's really funny to see the commissioners are old Board of Health people like Robert Chappelle
Yes.
and Linda Shea. and-
Yes.
Yeah.
Can they, like,
That's
say
good.
they were having an event at their house on that Wednesday
That's
evening,
why.
can they request that it not be sprayed then?
Yes, so you can
Okay.
request, or even you don't want it, say you, I don't know, you don't want your area
Property
sprayed,
sprayed.
you can ask.
Okay.
You can send in a request.
So
So you
they-
can ask
will
for
they-
spraying and ask not to be sprayed.
Okay, so if they say not to be sprayed, does that include the whole street, or does that include
No,
just
that's
the
your,
property?
because your neighbor might want to be sprayed.
Exactly.
So you
Okay,
can't, it's usually
okay.
just your
Your
area.
property,
yeah.
okay.
But, I mean, how does it keep it from,
Well,
yeah,
just like your neighbor may put
It's just a
chemicals
good
down on their
thought.
lawn and you don't. It's just,
Right.
you
yeah.
know.
But
all
you
those-
don't want to be having some kind of a facility, have them spray it over you, people sitting in your backyard. and
While you're
spraying
barbecuing.
over it.
Yeah.
Yeah.
Right, and that's why it's Wednesday evening, which.
Yeah.
Oh, that's a
usually-
big thing. That's,
Yeah,
that's
it's
huge.
for Norwood, it's Wednesday.
Yeah.
Different communities have different days, but.
Right.
we
And
happen
most
to be
people don't
Wednesday.
have a function on a Wednesday
Right.
evening, but just,
But you could, so it's good to know that you can go up there, and you have to get it in by a certain time, so they'll know to take you off the list, because you
Okay.
can't do it last minute, then you
Yeah.
won't be able to.
yeah.
They only do it once a year though, right?
No, it's every week.
No.
It's every
just-
week?
Nope, go on that
Oh.
site, and it will tell you when it starts, and it's every
Okay.
Wednesday, yep.
Every Wednesday. Oh,
But
good to
you might
know.
not be done on a
But somebody
particular
in
day.
Norwood,
Yeah,
some
it's the
street
town of
Norwood will be
Norwood will be done.
Okay.
So your section of town, if you look, they'll put the maps up, and it will tell you
Okay.
what section of town they're going to do on a particular date.
Okay, great. Okay.
And then one last thing I just want to let you know about is, we're working with the state to receive free MMR vaccine.
Ooh.
You
nice.
have to be, so there's a Vaccine for Children program,
Uh-huh.
and that is, it's only for children up
Right.
through age 18 that we can receive free MMR.
Uh-huh.
There's also, you have to have a certain freezer, you have to have, because it's frozen, so we did order a new freezer that meets all the requirements. There's a data logger that keeps the
Nice.
temperature, keeps a log of the temperature. So, we had to go through a training, so Diana had to go through a training, which we already did, but we had to go through it again, on how to safely handle vaccines. And then a backup, so I took it to, so we ordered MMR vaccine today. So we're gonna start small, we've notified the schools, if they have anybody new coming in that's missing an MMR and can't get to a doctor, or they don't have a physician yet, they can get the MMR through us.
Okay.
Oh, that's good to know.
Because when they come in kindergarten, they have to have.
Measles, mumps, and
all their
rubella,
shots.
yeah.
Correct, you have to have
Okay.
2 doses. So usually you get the first one anytime after the age of 1 year.
Yeah.
And then the second one you get when you're going into kindergarten. It can be anywhere 4 or 5.
5, yeah.
So you'll have 2 doses. But if you're moving here and you don't have proof,
You could have it.
you have to have another one.
Okay, and then would you have to have the second one 4 or 5 years later?
You have the second one again, yes. So you have to have 2. So everyone has to have 2. So then you get another one.
So if they have no proof, they would have to go through, they would have to get 2.
Right, anybody
Not at
starting
the
school.
same time though?
No,
Same
no.
time, it's spaced out.
Base,
Yeah.
okay.
Can they go to school with one if they've come to here?
So you can go to school with, so the one vaccine is pretty much 95%
Oh, okay.
efficacy. So that second one is just to get you up a little bit higher, to get you up to around 97, 98, get you up there a little bit better. So one, you have a lot of protection with just one.
Okay, good.
But a lot of times people, if they don't have their vaccine record with them, and they don't have an electronic record, they might not have it. But most other states, most other countries do have MMR. But
Thank you.
still,
Yeah.
you still want to make sure, especially with this outbreak, which is over 1,000 cases now.
Yeah.
We just want
It's
to make sure.
mostly in Texas.
Deaths, 1,000?
California, no.
No, how many cases?
Cases.
And it is spreading to other states.
Yeah.
I mean, you hop on a plane and you're there the next day, you go to Disney World, you go to, you go
Yeah,
to
but
amusement
religious
parks, you
reasons
go
they
to-
don't, for religious reasons, they don't inoculate their children.
So yes, there are exemptions. So there's medical exemptions if you have a severe reaction or you can't, you're undergoing a bone marrow transplant or you're on chemotherapy, you can't get it right now. And then also there are religious exemptions. So if you have a sincere religious exemption, you can fill out that form and not get, not just MMR, all vaccines.
So that child still goes to school.
Religious exemption, you can still go to school, yes. There are some states that do not allow a religious exemption. That could happen at some point. I don't know. I haven't.
It just doesn't
They've been
close the
talking about
circle
it.
to me if we're,
Well,
inoculating
my feeling
half
is-
of it and then the other.
I feel badly for that child because they are more susceptible if
Oh, sure.
that happened, if somebody with measles happened to walk by them and sneeze, then they would be, whereas a child that got the MMR, it
One
would-
thing you have to remember too is if you do go with the exemption, and there is that disease, whether it's chickenpox,
Right.
which is more likely, any of those diseases, you're out of school.
Yeah.
And then it's the next case, because remember, it may spread, so maybe more than one case,
Yeah.
then you're out again. I mean, you could potentially miss months of school.
Yeah.
School, right.
'Cause
Because
that-
chickenpox goes is a 14-day incubation
Yeah,
period.
so you're
you
Oh,
out
know,
it is.
through the
Oh, yeah.
incubation
Get that,
period.
yeah.
Yeah.
So you can be out a very long
I
time.
don't know what the incubation is from measles. I'm not
Very
sure
long
about
time.
that.
So,
Oy.
Well, I know it's very contagious, but I don't know
It's
how long it
extremely
is.
contagious,
Yeah, how
and the thing
long
is that it's also very dangerous for pregnant women,
Yeah.
along with, can cause deafness and
Along with
blindness.
us old people too.
And old people with shingles.
Yeah, yeah,
So-
I know.
Okay, great. Stacy?
so that is it from me.
Thank you, Stacy. I have one for Stace.
Okay.
I don't know if it's appropriate, but Stacy, what is the update on Norwood Hospital? Can we discuss
I don't
that?
have any new updates.
Okay, well, the town, we're not anywhere with the town after Tony's meeting with the town saying that we were gonna hire somebody and he put the task force together. And it's a very capable task force and no state visits, no nothing?
Not that I'm aware of.
Still in the works, and
Yeah,
I
there's
think
still
it's
stuff
down.
going in the background,
Yeah,
as
it
always.
is gonna be a hospital, and I think they've figured it's down to 3, the last I heard, but that's not official.
So the determination of need is in place?
No. Well,
Well,
How can it be a hospital if it's not in
They
place?
still
up
have to
for-
apply for a new one.
Yeah, and they're questioning whether the old one is still going to
Viable?
be in force, because when they canceled it, they said that they didn't, or they couldn't cancel it, that it was supposed to be good until a year from August. It was supposed to be good for that length of time, but there again, that's up for question.
Well, then my question is, how can people be interested in the hospital if there is no determination of need for a hospital?
Well, it depends. One person will tell you that there is still the emergency DON, and other people will tell you that they have to apply for a new one. I think what they're waiting for now is what the hospital's gonna cost, what the bottom line is gonna cost. Now they're trying to figure out what the cost is versus what they got for insurance. And then they can deduct that amount of money from what they're asking for what the insurance is, but the insurance company isn't telling us how much they gave them, and nobody's saying how much they gave them, so that's kind of like where they're at. They have to take a good guess on how much the insurance company gave them, and then they can set an amount. Once they set an amount, then it's a go, then.
So we are actively still working towards
Oh,
this.
yes.
yeah.
It's just that there's no notification. People say, well, you're the Board of Health, you know. There's no notification to the general public
No.
about any of this.
Well, the task force has updates once a month to the meetings. Usually I believe it's the last Friday of the month, they will provide some updates. But if there's no new updates and they're moving along, they're not gonna provide that until
Okay.
it's definite.
So-
So I don't have any new updates.
So the task force doesn't have a monthly meeting?
There's a monthly meeting, it's usually the last
Friday.
Friday of the month.
At noon time.
So you just,
Yeah, so it's been since last month.
Jen,
last
is it
Friday.
this Friday or the following Friday?
It's scheduled for this Friday,
This
as
Friday.
long as there hasn't been any changes, we haven't heard anything, so
Okay.
my belief is that it's still on track for this week.
Okay.
so who's doing the negotiations if the task force isn't? Listening to these 3 people that want the hospital and stuff like that. Who are these people that, like Joni said, or Joni, you can answer the question, that are applying for the, well, we don't need to know that, but who is following it along if it's not the task force? Tony? I mean, he's
Well, I mean, it's a private, it's.
private.
I mean,
See,
everyone-
that's the word.
No, I mean, it's a company, you're asking a hospital to come in and take over another hospital. It's really not, it's not up for the town
Okay,
manager to
alrighty, that's what-
negotiate it, for us to negotiate.
Okay.
Everyone knows this hospital's here.
Right.
All the major healthcare
Players.
certainly know that there is a hospital here. It's a business.
That clarifies it
So-
more, that it's a business
Yeah,
and you
I
don't
mean,
discuss
it's a-
everybody's business with the general public.
Right.
Well, we all want to know, of course, the general public wants to know,
Yeah.
we need a hospital.
But
we
they're
need a
not
acute
gonna
care
put it,
hospital.
they're not
No.
gonna put
They're
it
not
out
gonna
there
tell you
until they're
what you-
pretty
yeah,
sure.
They're not
right?
Well,
gonna
that's
say
gonna
we're
be my answer, yeah.
negotiations or,
Because everybody will be, the
Because
rumor
everybody
mill
is
will be-
asking.
Yeah.
Oh, it's already going, yeah.
Yeah.
Thank you, thank you.
Trust me, you'll find out long before it's,
Yeah.
it's
No,
fine.
but people walk around and still say, could you tell me? And
Yeah.
it doesn't make any sense, you don't know, you're on the Board of Health.
It's all private sale, it's like if somebody.
Well, that's what I'm gonna tell them, it's all
Yeah.
private sale.
Yeah.
It's, I mean, not to simplify it, but it's like if a restaurant goes out,
Right.
you know, you can ask
How much-
Joan, hey, Joan, what's going in there next? I don't know, whoever buys it. So
Yeah.
it's kind of the same.
Okay.
Not to oversimplify it, and I didn't mean to make
No, no,
light of it.
no,
because
I
it
No, no,
certainly
no.
is huge, but,
Yeah.
um,
And then, like I said, they're
Simple
not
as
gonna, put information out there until they're positive.
Right,
Because it just
right.
causes too much
But
unrest.
there is a lot of interest in it, Kathy.
Oh, I know. There's a ton of interest
There's
in
a
it.
ton of interest in it, so
Hmm.
it's gonna happen.
I mean,
It's
there's
just a
still
matter
the
of when
rumors
and
out there
who.
that it's gonna be apartment buildings.
No,
It's
no,
like, oh, for
no,
God's
no.
sakes.
It's still gonna be a hospital, it's just a matter of when and who.
Who?
Yeah, it's funny, everybody hears something different. You could stand at the corner,
Well,
and in
and
3
then-
hours, you'll get 26, I heard, and I heard, and I know.
Yeah.
For a fact that you know,
Yeah.
but you're not telling anybody.
I wish I did, but no, I don't. It just,
All right, thank you,
it's
Stacy.
a good guessing
Joni.
game. Yeah.
Do you have anything, Joe?
Nope.
No,
Oh,
I
good.
don't have anything either. So,
We have our next
we
meeting.
have our next meeting,
Yes.
June, and then we'll be off until September?
Yep.
Okay.
I
Next meeting we'll make for September.
Yes.
Put that on,
Fall
so
schedule.
we'll schedule it, okay. Somebody
And the
want,
next meeting is June what?
June 20, I'll tell you one second.
Yeah, I know, I was gonna say. when-
June 23rd, Monday, June 23rd.
Yeah.
Okay.
All righty,
All right, someone want to make a motion to adjourn?
Motion to adjourn?
I accept. Second it?
All in favor?
Aye.
We are adjourned. Thank you.
Thank you.